Assalamu alaikum and welcome to the very first podcast of APPNA Alberta podcast series. In this series, we will explore and discuss different ways our health affects us and the community around us. And I'm your host, Sidra Rahim, and today's episode is Dental Health Mythbusters Rapid Fire. We'll be breaking down the most common dental myths that we hear in our community. I'll say the myth, and our expert will clear it out for us whether it's a myth or a fact with a quick explanation. We have with us Dr. Abdul Qureshi, a general dentist practicing at Glenmore Landing Dental Center and East Chestermere Chestermere, Calgary. He's the member of the College of Dental Surgeons of Alberta, the Alberta Dental Association, and the Canadian Dental Association, and is also affiliated with the PMDC as an assistant professor. Hello, Dr. Qureshi, and welcome to the APPNA Alberta podcast.
Assalamu alaikum. How are you? Thank you very much
Good.
for having me here.
You're welcome. Thank you so much. Are you ready to bust some myths, doctor?
I'll try my level best.
All right, so we'll try with the money part of the dental health, which is the dental insurance. So we'll start with the myth, whether it's a myth or a fact. If you're low income, you have no dental care options.
That's a myth. In fact, there are different programs available for the low income. And
Mhm.
nowadays, Government of Canada is offering CDCP, which is a Canadian Dental Care Plan. If your income is lower than 90,000 per year, you can apply for it and you are eligible. And they are covering almost every treatment under this program. And there are some other programs like ADAC program for the low income, and some people who are really in the low income, they can apply to that program too, to the government of Alberta. Government of Alberta is also providing dental care to the senior citizens once they are 65 years above, and they can apply and they can get some grant from the government for the dental care. So it's a myth.
Yeah. All right, myth or fact, no insurance means no dental treatment ever.
I think that's a myth again. As I mentioned, there are different programs. They
Hmm.
need patient needs to apply for it and get eligibility for it, and they
Hmm.
can get the treatment.
Okay, moving on to the next one, myth or fact, buying dental insurance on your own is always a waste of money.
There's no direct answer for this question, but I would say if someone is working as an employee and they don't get insurance from their employer, then maybe because in that way they can spare some money for the dental treatment in case they have to spend at once. But if someone is doing their own business and they are having good amount of money with them, then there's no need to buy private insurance. But if someone is an employee and it's hard for them to spend money at one time, then I would say maybe they can buy a private insurance for themselves.
We'll move on to the dental hygiene now. So the first one would be myth or fact, brushing harder cleans your teeth better.
That's a myth. The fact is, plaque or the biofilm is quite soft and is a tenacious substance on the teeth. And if you brush gently, but you have to brush thoroughly. It's not it doesn't mean that you have to brush hard. Though if you brush hard, that may also cause some tooth damage or the tooth structure removal. And it can be harmful to the gums as well because the gums are also quite delicate.
Fact, brushing once a day is enough if you do it well.
No, brushing should be done twice a day. It's more important because the biofilm gets thicker if you don't remove it. And biofilm start getting forming right after the brushing. And the more the time passes, it becomes thicker and thicker, and it attracts more colonies of the microbes, and then it becomes more dangerous. So that's why it's important to to do the brushing twice daily, and the brushing in the night before going to the bed is more important because throughout night we have very less salivation or almost zero salivation. And if the mouth is dry, and if you don't brush your teeth, if the teeth are not clean and the mouth is not clean, the microbes have more opportunity to work and they could be more dangerous. And the other thing is no one can brush 100% correct in one brushing or one go. So that's why it's always advised to brush twice daily, and that's the way to keep your teeth healthy. But yeah.
Okay, so next one is a very important one, especially for me. Electric toothbrushes are just fancy gadgets. Manual works the same. Myth or fact?
The studies have suggested like if someone brushes properly with either manual or electric, the both of them have the same results. But unfortunately, like most of the time, in fact, most of the people they just brush in seconds, so that doesn't brush like your teeth properly. They don't clean the teeth properly. So that's why the electric brush would be a little bit better in that sense because it has got more vibrations and more strokes, and they can clean your teeth more better way. So that's why, and especially the electric brushes are very good for those who have some movement limitations like arthritis and those people that can work better for them.
All right. So, myth or fact, if you brush properly, flossing is optional.
Now, flossing is one of the important factor for your regular dental hygiene. The reason is brushing only cleans 60 to 65% of the teeth. The rest of the portion of the teeth, which is in the contact area, is remain untouched. So you have to do flossing on regular basis, at least once daily.
Right? Myth or fact, does flossing causes gaps between teeth?
No, that's a myth. Actually, floss is better for your teeth. The reason is it's quite thin and it slides like in the contact area very easily, so they don't cause any spacing and they don't exert any pressure on the teeth. So there's no question of like creating spaces. And the other thing is the flosses comes with the fluoride, so they provide a kind of protection from the decay in the contact area as well.
Interesting. Okay. Myth or fact, fixed bridges don't require flossing.
No, those bridges are also very important, need to be cleaned with the flossing. But there are some special type of flosses which go underneath the bridges, and they are called super flosses. And the difference in the normal floss and the super floss is that like one end of the super floss is a little bit harder, that can be easily slide in underneath the bridge and which can clean all the areas under the bridge because there are some soft tissues or gum which are underneath the bridge. So they needs to be cleaned properly. And that's why the super flossing is advised for those fixed bridges.
Myth or fact, water flossing is better than regular one.
And that's a myth again. The water flosser is an additional measure rather than a substitute for the normal flossing. So water flosser can help those people like just to remove the major debris from that area, but even it does not give you the 100% cleaning or removing the plaque from the contact area. So still they need to do the normal flossing. Water flossing just should be considered as an additional measure. Water flossing is only better for those people who have deep pockets of the gums where the brushing and flossing doesn't reach. They can help you a little bit to remove the chunk of the like food or debris from that area.
Okay. So next one would be myth or fact, all toothpaste works the same. Just pick any.
It's not true. The toothpaste should have fluoride at least, and any fluoridated toothpaste is okay. But there are some pastes, like especially the whitening toothpaste, and their pH is quite low, then they are acidic. So they may either like cause a little bit more tooth loss. So it's better to have any toothpaste which has a fluoride in it. And the toothpaste like can be chosen according to the age as well, depending on the amount of the fluoride present in the paste.
Okay. So next one would be myth or fact, dental scaling is only needed if your teeth look dirty.
That's a myth. Fact is, it should be done on regular basis every 6 months at
Okay.
least. Because still we get some deposits of the tartar and biofilm, and they should be removed with the scaling or with the hygiene from a dental hygienist. The other thing is if someone has some problem, like if someone is taking medication for allergy, for blood pressure, for diabetes, these medicines for even anxiety or depression, these medications they tend to reduce the salivary flow in the mouth. So if you have less salivation in the mouth, it means less washing effect you have in your mouth. So then these hygiene procedures they are advised more frequently, maybe every 3 months or maybe every 4 months.
All right. So next one would be you only need dental cleaning when there's pain. Myth or fact.
No, it's not like no fact. It's a myth. The dental hygiene, as I said, it should be on the routine basis, whether you have pain or whether you have no pain or at all. And normally, if your teeth and gums are healthy, there shouldn't be any pain at all.
And 6 months, you said. We should get it done
For
six
any
months.
individual without any medical condition is 6 months. But if someone has a medical condition, as I said, diabetes also reduces
Mm,
the salivation and it causes xerostomia. So the
mm.
teeth are dry and the mouth is dry. They need more frequent visits for the hygiene, maybe every 4 months or maybe every 3 months.
The next one would be myth or fact. Kids don't need dental hygiene visits until they're teenagers.
Since the child has the first tooth in the mouth, they should start visiting dentists. We do hygiene for those patients as well, or for those children, because once they get the first tooth in the mouth, the microflora, which is like a normal microbes living in our mouth, they don't cause any problem. The nature of those microbes, the microflora changes with the eruption of the first tooth. So they should start seeing dentists since they have the first tooth in the mouth. And normally
Mhm.
every child is different, and the teeth eruption is start from 6 months to 12 months. And since then, they should start visiting the dentist. And as early as they start visiting the dentist, they get more familiar with the dentist and the dental clinics, and then they don't have the dental fear or anxieties in the later on in the age.
That's true. All right. So next one would be myth or fact. Sensitivity after scaling means something went wrong.
That happens only with those patients who don't go to the hygiene for the hygiene on the regular basis, and if they are 30 years, 40 years, and they never saw the dentist for once
Hmm.
before, and if they get hygiene, then there's a thick layers of the deposits are the harder tighter, and when they are removed, those areas of the teeth are a little bit exposed for a few weeks because the gums were inflamed, and when you remove those carpet of the deposit, the teeth are a little bit sensitive to cold mostly, and that lasts only for a week or two, but still we have some medication which we can apply after the hygiene to reduce the sensitivity. So it's not like anything abnormal, and it's just a transient for a week or two and then it gets better. But the other thing is, if they don't get the hygiene, then those deposits can cause the bone resorption and they may lose the teeth eventually. And there is a myth like, when we'll get old we have to lose the teeth. That's a myth. I have patients, they are 90 in 90s and they have their teeth healthy because they are maintaining
Oh,
it.
well, that was a big myth. Myth or fact, sensitive teeth always means cavities.
Cavity is one of the reasons. There are some other reasons as well which may cause sensitivity, which could be tooth wear, which could be a crack of the tooth, which could be hard brushing, which could be like, chewing bitterness. Anything can cause a little bit sensitivity. There are like, different reasons. So we have to see the reason for the sensitivity. But cavity can also cause sensitivity. That's one of the reasons for the
Mm.
sensitivity.
Oh, okay. All right, so the last one for today would be myth or fact, bleeding gums are normal and harmless.
That's not normal. When the tissues are inflamed, they bleed. So as you know, there are the five signs of the inflammation. So one of the sign is the bleeding from the inflamed tissue. So when your gums are inflamed or infected, they are tend to bleed with this normal touch, like even with the brushing and flossing. So it means your gums are not healthy. So don't take it light, and it's just one of the initial sign of the inflamed gums, and you should have the hygiene on the regular basis, and I'm pretty sure that will go away if you keep your hygiene very well, like which includes your hygiene regularly, checking with the dentist, and plus brushing twice daily, floss every day.
All right. Thank you so much, Dr. Qureshi. That was really helpful information.
Thank
And this wraps up our Dental Mythbusters rapid fire. Remember, prevention, regular checkups, and good habits go a long way. Thank you for listening and see you next time.
Thank you very much. See you next time.